what does the 21st century optometric office look like in today's society? Because all the things that you touched on, from having a better relationship with patient to expand in scope, you got to have an office to be able to uphold those things that you mentioned. So I'm curious to know, what does that look like to you? What does that look like in your practice? Because clearly you're all about cutting edge technology. So let's spend a little bit of time on that, if you don't mind.
Yeah, I actually get asked this question quite a bit, or have been asked that question quite a bit lately. And, in some ways, the practice of the office of the 21st century is just like the practice of the 20th century.
Okay.
Um, you know, and there are some things about optometry that shouldn't change. And those things, which should be part of the 21st century, we should carry on some of the great things that we already do. And one of the great stories that optometry sometimes tells well and sometimes doesn't, and that we are embedded in our communities and we look like our patients for the most part. There's a scarce Medicare county where we do not exist. We tend to have longitudinal relationships with our patients, whether if you're on a city block or out in a practice like mine, and our patients trust us. So I would encourage people to get settled in a practice, develop longitudinal relationships with patients because it matters. Those longitudinal relationships engender trust. And there's even health outcomes measures that say if you got the same docs, whether it's primary care doc, your eye care, you have better outcomes.
Yes.
You live a better life. So that's something I wouldn't change. Remember to be, part of your community. Things I would change is some of the things that you all are doing. I was very excited for you and your buddy Adam to come to NECO, and I'm going to brag on you just a little bit. We gave you guys an award for the work you're doing to diversify optometry and ensure that there are optometrists that look like the patients they serve in their communities.
Thank
And I think that's real important. I mean, I was so excited that you two are the ones that were recipients of that award, because that's part of the promise,
Yeah.
to
And
take
I
care of.
appreciate that. And I want to give a shout out to Dr. Howard Purcell and the whole team and your board for
Yeah,
understanding the importance of that. Right. And the thing that blows my mind, and it's just very rewarding to see the students. The students want it more than anyone else out there,
yeah,
right? And these
yeah,
are students of all backgrounds. When I was at the school, they come up to me and they say, "Thank you. How can they be involved? How can they, make an impact and make a change?" So
yeah.
clearly there's something special over at that school where
Mhm.
it's really changing the way that we look at optometry school. It's changing how we go to different colleges, and they're not taking that traditional route. They're really thinking outside of the box.
Yeah, absolutely. And as you learned earlier, it is that global perspective.
Yeah.
But I then came back to Boston, which is an international city, and I
Yes.
think NECO is an international college of optometry. And let me just be clear, I'm plugging NECO here. We have all walks of life, like literally. We have in a city that is one of the most diverse, and so it's a great place to train because of that, right? But we all disperse back into our respective communities, or we're inspired,
Hmm.
hopefully, by through that process to go somewhere where someone really needs us, where we can be not just our best person, but the best person for the community. Um, so the 21st century, as I said, looks a little bit like some of the great things that we've done already, but in terms of business and innovation, I think
Yeah.
there's some super exciting stuff going on. When I consult with companies, I'm like, listen, we need cheaper, smaller, faster, better.
Mm.
Like, it's easy, cheaper, smaller, faster, better, because we need to be able to do our jobs in a way that doesn't completely, eliminate our ability to earn a living, right? We need to
Right.
be incentivized to do the job that we do. And so I think what you're going to see, you'll see more mobility in the devices that we use. I mean, there's some great devices on the market now. You'll see a lot of AR headsets. I think that's going to come and go. But
Yeah.
what will come from that process, I'll tell you a funny story about a 2 megapixel camera and why I think this, um, is the processing and the manufacturing that's required to miniaturize and to mobilize our ability to uh, do diagnostic testing on patients in small spaces all around the world. So that is an exciting trend. I mean, I could name all kinds of companies that I think are doing some amazing things and that will pull us into the next phase.
Well, I
So
want to expand on that a little bit because you mentioned something, smaller spaces, right? Do you feel like the dream of having a huge, large practice will change in the next 5 to 10 years with innovation, simply because of what you said? Smaller, quicker. I can't remember everything exactly, but
yeah,
like,
yeah.
do you think the practice is going to change in regards to the size that most folks want because of the technology and innovation that is there?
I think we're going to have more flexibility, right? Everybody wants a nice office, right? Real estate is less expensive in a rural area. It's more expensive in the city. I'm in a rural area. Like, it's not a big deal to have a big room like this. It's
Right.
a big deal to have a big room like this in the middle of New York City, right? It's not happening. You fit 3 exam rooms behind me over here. And but to meet the demands of the overall public, which are blowing are insane, and I could talk about all those statistics all night long. But not enough doctors, too many patients. You know, we're going to need to have spaces that are modular, that are flexible, right?
Okay.
And so that you can move around your space, you can change things, you can bring in new technology, and it doesn't mean you have to build a whole nother building, right? I mean, those are the things that are going to win. I think that mobile I talked about, where do I think telehealth is going? And I've been involved in telehealth since 2002. We didn't even call it telehealth then. That's going to have its place. I think it's going to largely be focused in primary care. Hospital at home is a real thing that is being looked at right now. I think telemental health is like the most amazing thing ever, where you can reach people all over the world and match them
Yeah.
to people that have mental health experience. Same with nutritional and wellness. I think we're going to be able to access people or providers in that regard. Um, but yeah, I mean, there's all kinds of tech. There's a little tiny bit of telehealth, but we got these round things. They are really hard to examine remotely. And I'm not against telehealth. I mean, I think it's a great use. We're all going to do it to some degree in some form in the future. So yeah, that is part of the 21st century. How we do it is still developing. So we need to refine that. And it's going to be, and what will drive that, I think, is this absolute demand to triage patients medically. We have a 7-to-1 caregiver to provider statistic right now. By the time I hit Medicare age, which isn't that long from now,
It's
uh,
21. What are you talking
it's
about?
going to be 3-to-1. There's going to be nobody. I look at my 3 boys and I'm like, okay, who am I coming to live with? Because there's going to be no nursing home capacity. And then it's the wives that go like this. I'm like, come on, you love me. But we're going to have nursing homes filled to capacity. We will have assisted living filled to capacity. We have a huge public health challenge ahead of us, which will also drive that optometric office of the 21st century. We're going to have more offerings in one space, and that's across the spectrum. Whether it's, now, I don't do retail optical, I am hardcore medical, but I work with 2 other vision source practices that have the full armamentarium within a really close area. And we serve thousands and thousands and thousands of patients. There's no ophthalmologist within 40 miles of my office.
Wow.
I am across the driveway from a critical access hospital. I am 15 minutes from a federally qualified health center and 2 urgent care centers. I take all the emergencies, and I need to get it right every single day. So I feel grateful. I feel needed. It's a huge challenge. If you want a challenge, come on out. We can use some help over here. So recruitment is a challenge here. But like I said, the Office of the 21st Century is going to have all the offerings from optical to medical and surgical, and we're already there, right? We are
Absolutely.
already there with our education. We now have 18 states that are by scope have laser lumps, bumps, injections, and procedures approved. There are not enough ophthalmologists. This is very clear, and there is no clear pathway for them to increase their numbers right now. And it's the same across all of medicine. I mean, there's days where I get people in here, I'm like, oh, sweetheart, I'm like, I know exactly what's going on with you, but that's your heart. So guess what? We're going to have a short trip over here to the emergency room. Or, no, no, that's a stroke. We're going to have a short trip over here in the emergency room. So it's serious stuff. It's
Yeah.
serious stuff.
Yeah. We
Um,
got Heather Harrington tuning in this evening. Thanks for tuning in. We appreciate the love and support. And she agrees. We definitely need someone promoting our jobs in this industry, talking about how amazing this industry is and how cool our jobs are as well. Right. She also mentioned something earlier when we were talking about relationships. Something they do in their practice is write simple notes about patients in EHR. If they're going on a trip, having a baby, ask about it at the next visit, and the patients love it. And I do the same thing as well. And it's gotten to the point now where I don't even have to take the notes. I remember it because my patients are like my family, right? I see them out in my community. I practice in my community. They invite me to different events. Hell, I
yeah,
got one patient. She's so sweet that she's giving me free courtside Duke basketball tickets, right? I mean, that's how of an intimate relationship that I have with my patients,
absolutely.
and it's because building that trust, building that rapport, being in the community, that longitudinal deal that you did discuss earlier. It's very important to make sure that you're making these things happen. But no, I agree with you. Having this type of office, this type of setting, we got to change our mindset.